Canadian drug companies face a billion-dollar lawsuit, psychedelics appear to stop addiction, and Canadian-American trade relations improve. I'm Marco Perri. Welcome to the Perri platform. Drugs are all over the news today. The first story I want to talk about is Canadian drug companies are now facing a billion-dollar lawsuit over opioids. First, before we even get into the details of the lawsuit, let's clarify what exactly opioids are. You can think of them as a family of drugs or an umbrella. Examples include codeine, oxycodone, morphine, phenylketonuria, etc. You may have heard these terms before in some of your favorite rap songs. Typically, these drugs are used to control pain, but they come with a vast array of other effects. They can create feelings of euphoria, which makes them problematic as the appeal to abuse them is really there. The way these substances can affect you vary greatly based on a number of random factors ranging from your height to how long you've been using the drugs. The standard procedure for the availability of these drugs has long been available only via prescription, but the entire process has been extremely lax. Combine that with the fact that these drugs have a highly addictive side, and it's been a recipe for disaster. Here's a situation that occurs more commonly than we would like. Let's say you have an operation and are prescribed opioids to deal with the pain. You start to really like that euphoric high it produces, and you've been using them for a while. As a result, it becomes a habit. When the pain subsides and you no longer need the drugs, it's not always easy to let go. So, you might go to your doctor and say you still have issues, or, even worse, you might look towards the black market to fulfill your cravings. That's a pretty rare situation, but it happens. On the other hand, let's say you do get off the drugs. There's going to be withdrawal symptoms because if you've been on them for long enough, your body would have developed a dependency. These symptoms can range from uneasiness, cravings for the drug, goosebumps, cramps, anxiety, insomnia, and the list goes on and on. Opioids are classified as depressants. In other words, they slow down your functions like brain activity and breathing. This probably presents one of the greatest risks of taking the drugs. If induced in too large a dosage, they can outright kill you by stopping critical bodily functions like breathing. It's a very slippery slope because even if you are using them as prescribed, you develop a certain level of tolerance the more you use it. This is the same with pretty much every drug, and you'll need to up the ante a little bit if you want to get similar effects as the last time. If you're not being supervised, you could easily reach a critical point, and once you pass that limit, there really is no turning back. Now, we get to the lawsuit. Canadian drug makers are being accused of enriching themselves at the expense of vulnerable patients by illegally and deceptively promoting highly addictive opioids to them. These drugs have killed thousands of people in recent years, and the issue seems to be growing. These claims have yet to be proven, but that's where we have the court system. The lawsuit is seeking over $1 billion from numerous companies including Apotex, Johnson & Johnson, and more. I don't know about you guys, but I was pretty surprised to find out that Johnson & Johnson, they're actually a major drug producer. I thought their primary line was like baby products, but turns out I was wrong about that. So, patient testimony from those who became addicted are also claiming that the companies didn't research, develop, and market the opioids adequately. The claim is the companies knew that people who were using the substances were going to be at a great risk for developing addictive tendencies, but they still did not do enough to mitigate that. If we look at the history of opioids, they've been around for quite some time. It's nothing really new. Prior to the 1990s, they weren't common in medicine because the medical community viewed them as too addictive, but that perspective changed. Companies started to market these drugs as safe, effective, and appropriate for long-term usage when dealing with pain. In this case, the lawyers label that as aggressive marketing. Looking at the numbers, it's clear we have an issue on our hands. In the past 20 years, over 20,000 Canadians have died due to fatal overdoses. In the US, opioid-related deaths kill more people than car crashes. That number right there is astounding. One thing we as consumers need to do is change the way we view these substances. At the beginning, I jokingly mentioned rap music, but now I'm seriously making the connection. You have people trying to romanticize using codeine, Percocets, and a vast swath of other highly addictive drugs. Simply put, it's idiotic, and lots of young people look up to these rappers for whatever reason, and the people who look up to them are susceptible to trying these things from these pseudo recommendations. They'll hear someone famous talking about the wonders of using them, and these impressionable youngsters, or maybe not even youngsters, anyone can be impressionable. They'll think it's cool, they want to be cool, they want to fit in, and the culture's there. So they'll be prone to trying these things, and as I mentioned before, it's a very, very slippery slope with opioids. I'm a firm believer that rap promotes a lot of messed up notions, and you would be too if you analyze the lyrics. There's no way you can deny it. So much messed up things are commonly used in these songs. It's become normalized, and I fear that's going to become normalized in culture of consumption as well. A lot of people are going to glaze over the notion that rap plays a part here, but I'm trying to hold them accountable because it's almost undeniable that they've made the issue worse. That's a separate conversation though, aside from the lawsuit, but it's something that needs to be looked at because it is a part of the overarching issue here. The truth is, you should avoid these drugs unless you need them for medical reasons, such as extreme pain. The positive effects of opioids are certainly there. It's clear that when used appropriately, they can help a lot of people. This is not the case for those who abuse them though, and take them for fun. Those people are likely to destroy themselves. If you are subject to usage of these drugs, you need to be aware of the effects and mentally prepare yourself to avoid the risk of dependency. Doctors play a role, the companies play a role, and we play a role. At the end of the day, I think it's a fair lawsuit, and these claims seem to have merit to them. I just wonder, what exactly is a billion-dollar lawsuit really mean to these companies? Keep in mind, it's a bunch of billion-dollar firms, and it's only a billion-dollar lawsuit amongst them. It's not even $1 billion each. These guys are giants. It really is a small dent to their combined income. What happens if the sales of opioids generate more profit than they stand to lose in a lawsuit? If that's the case, which I feel is somewhat likely, they really don't have the incentive to change at all. It's a slap on the wrist. Let's use another example to maybe put it in perspective. If I'm selling, let's say, turtle shells, but it's illegal to do so, I make about $100 per shell, but if I get caught, I'm fined at 5 cents. Those numbers seem to be absurd, but in the context of these companies who make $1 billion in the snap of a finger, especially cumulatively, it seems to me that there really isn't enough of a high consequence for the actions they've taken here. In the turtle shell example, it makes every bit of sense for me to continue on in my current ways because I'm still making a killing. Even if I'm caught and pay a fine here and there, it's nothing to me. The bottom line is there, so why would I change anything? This lawsuit definitely needs a higher consequence or you're just going to get a lackluster response from the companies. Adding on to that, I'm not sure that the companies are even solely to blame. What about government regulations? What about medical professionals? It's a chain reaction of events, but I understand that one lawsuit does not have the scope to tackle all of these issues at once, but it's something to be aware of. The government can put restrictions on it, the health community can do their own research, the doctors can be better equipped to prescribe to patients and supervise them. It's not only the companies here. And as I said, the answer isn't to get the companies to stop selling opioids. They have numerous positive effects when you're using them appropriately. Abuse and falling victim to addictive tendencies is where the issue arises. Those things to me seem to be controllable in other fields. Then even aside from all of that, the issue of illegal opioids that are mass produced abroad, that's arguably a larger issue, but we'll talk about that next time as the lawsuit here does not encompass that side of things. But if you're interested and want to learn more, look up the illegal trades of opioids. It's a massive industry, and things like fentanyl have seeped into street drugs. It's become a major issue, and a lot of people have been dying as a result. That has to be cracked down upon too. So now we're talking about street drugs. That kind of acts as a segue into the next conversation I'm going to have, which is psychedelic drugs are showing promise in getting rid of addiction. After taking LSD, or psilocybin, 83% of alcoholics no longer met the criteria for the disorder, and 28% of those people who no longer were alcoholics after credited the transformation to their psychedelic experience. Multiple studies were conducted, and they all seem to point towards a positive correlation between usage and reduced addictive tendencies. In the 1950s, a study was launched that tested if LSD could curb problematic drinking habits. The findings were that the LSD had some effect, but it was not consistent. The research was put on hold because of the illegal status of those types of drugs. Now, decades later, scientists have opened that box again to delve a little bit deeper. The Journal of Psychopharmacology illustrates the report findings. The researchers who were part of this new study were intrigued by the previous one I mentioned that occurred in the 1950s, but they felt like it was incomplete and it could be built upon. To launch this new project, they recruited participants through social media and websites designed to basically discuss drug and research topics. They put out an anonymous survey and they collect data from that. From the survey, 343 participants who reported at least 7 years of problematic drinking before they had a psychedelic experience were collected, and those became the population of the test. From this group of participants, 74% reported that they tried LSD or magic mushrooms. The vast majority of those people did not take the drug with the intention of helping their addiction. Instead, the most common reason was they wanted a spiritual experience. As mentioned before, after taking these psychedelic drugs, 83% of the participants no longer met the criteria for alcohol disorder. In other words, they were cured of their addiction. The biggest question mark for me, though, is the relatively small sample size here, and this small caveat. Only 28% of people who had their drinking habits changed attributed to the drug experience. That leaves me wondering, what about the other 72% of people? What would they cite as the primary motivation for their change if it was not the drug? The researchers speculate that psychedelics help with addiction because they mimic psychotherapy, a form of healing. They say that if you speak with someone who has managed to overcome addiction, those people typically state that they were empowered by finally coming face to face with the big picture of life and what's really important to them. The conclusion is drawn that psychedelics help prompt that sort of deep thinking, and that's a key reason as to why they had the results they did. In other words, the use of psychedelics gets you to realize that your actions aren't productive nor essential via a series of trips. That summarizes what the report says, but it raises some questions in my mind. First of all, it's not well documented what else gets induced by these drugs. Maybe one effect is losing the urge to continue with your drinking habits, but I find it hard to believe that that's simply the only outcome. What if it's a bad trip? Would that worsen the problem? These types of drugs target your serotonin receptors, which alters a bunch of things, ranging from your emotions to your vision to your perception of the world. I find it highly plausible that you might lose something more than just your dependency along the way. If you break this down to its root, which is essentially looking at existence in a big frame landscape, alcohol isn't the only thing that's not really important. A lot of these people who took the drugs realized alcohol was not part of the big picture, so they found it easier to let go. A lot of stuff really isn't that important too, though. In the grand scheme of things, there really are only truly a few consequential items or facts that matter within these parameters. Love, survival, maybe a few more crucial aspects of your being, but outside of that, it's a question to how far deep the rabbit hole goes. Maybe you lose interest in your hobbies too. Maybe your personality changes. Maybe you stop liking certain things. What if the change seeps into your personality and you become a completely different person? It's unclear truly what the consequences really are. If we look at the study again, there's even a weird parallel within itself. It seems the drug is producing this outcome, but when you ask the respondents what they think, less than 3 out of every 10 people are crediting the psychedelic itself. Is it that they are unaware of the effects it had on them? That would be problematic if it's the case. Or is it because there's another factor at play here that we're missing? If, all of a sudden, you were an alcoholic, then you stopped your abusive behavior after you took a certain drug, it seems likely to me that you would credit that to the drug. But in this study, it's seemingly not the result. Something's really amiss with that. On top of everything else, there's the question of if these results would be transferable to the population as a whole. It wasn't a random sample. These guys looked out self-identified alcoholics who wanted to use psychedelics already. That's a niche group. Typically, studies like this always test for a placebo effect, but it's funny when you think about it in this context. It's too obvious in this case to be effective. If you are given a placebo instead of LSD or a magic mushroom, I feel like you'll realize pretty quickly that you aren't tripping and seeing elephants on the ceiling. The placebo is pretty much useless in this case. At the end of the day, the study really is only here to provoke further investigation though, and in that regard, it's useful. But I wouldn't suggest people taking the results as proven because that's not what the report is out to do, and it's certainly not a fact yet. So we'll see how this plays out. There really is potential there, but as I've outlined, there's a lot of questions that need to be ironed out before these things move on to the next phase of their trials. Now, finally, we get to something that's not about drugs. Canada The United States and Mexico reached an agreement to lift steel and aluminum tariffs. Trudeau and Trump spoke today about the tariffs that were placed on Canada, and in my opinion, as I mentioned numerous times before, it was a total nonsense move, but today they agreed to remove them. The tariff that the US placed on Canada last May was 25% on steel and 10% on aluminum. Canada retaliated with surtaxes of their own, and to this day, I can't even think of any justification as to why this happened in the first place. But at least now we've remedied that. According to CTV, the trade war with China played a part in this decision. It seems as though North America is trying to form a united front to help alleviate the pressures of China. If you think about it, Canada alone can't stand up to China. Mexico by themselves has no chance either. The United States can put up a fight, but as we've seen from recent news, it was kind of an even battle. The Americans were suffering, China was suffering potentially, maybe not as much, and now we're combining our strengths. This is a more strong position, and I fully expect better results to come of this. This really should have been the approach from the very beginning though. America went in Rambo style, 1v1, mano a mano, and it didn't seem to be the best result. Now they're taking a step back and trying to get allies on board. The aim here is to restrict Chinese steel from entering any market in North America. Right now, the other details of this agreement are scarce, but later today, Trudeau is expected to reveal more details about the agreement on live TV. Overall, it's very good news, and it does a bunch of positive things for Canada. It gives our steel and aluminum industries a better leg to stand on. They can export once again freely to America without this added threat of tariffs stealing away market share. And at the same time, we're now united in a positive position to fight back against China. If you want to learn more about why we're doing that in the first place, a couple episodes back I talk about the trade war and why it has transpired the way it has. Canada has a lot of reasons to be involved, and now it seems like we're going to get our chance to step up to bat. This is all contingent on the other details of this agreement being positive though. If Trudeau agreed to a lackluster deal, then everything was for nothing. But I have faith that this is going to be something positive. We'll just have to see when everything comes out. So that about does it for today. If you enjoyed the content, be sure to leave a review and follow us on Twitter at Perri Platform. Thanks for joining me, and I'll see you soon.